Well, this week we have seen a record number of new COVID cases in our area and nationwide. Nearly 2,200 people died yesterday. And once again, the hospitals are filling up. And to help us understand all of it, let's bring in our medical expert, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and also the chair of the Global Cancer Control Advisory Council. Good morning once again, Dr. Baskies. Thanks for being with us.
Good morning, Lucy.
We are at a critical point. Talk about the case trend locally and also what we all need to do or stop doing, really, to flatten the curve, especially since it's supposed to get worse post-Thanksgiving, right?
Exactly correct. We in this country aren't alone. Unfortunately, the virus is a problem in just about every country around the world, and especially in the countries like ours, which are in the Northern Hemisphere. So what can we do to flatten the curve? Well, the number one thing we can do is avoid COVID fatigue, which is what we are seeing in this country and around the world. It's clear that the one thing that makes the biggest difference to slow the virus's transmission rates is social distancing. There are multiple studies which show that overall, 85% of the United States population is already wearing masks. As hard as that is to believe, 3 studies have shown that to be the case. So masks are important, but social distancing is key. Right. The virus enjoys cold, dry air, and it's very easy to transmit from person to person indoors. The truth is that we can slow the transmission rate down, but we cannot stop it until we get a majority of our folks vaccinated, or unfortunately, there has already been natural infection. So social distancing is really the key now.
There's a lot of hope wrapped around this vaccine right now, the FDA's emergency vaccine approval. It could come this week. So what does that actually mean for all of us, especially since there's a dissemination scale, if you will?
So there's some really good news on the horizon. We are ever so fortunate that the collaboration between pharma and Operation Warp Speed has led to 3 effective vaccines in less than a year, and more vaccines, for instance, like from Johnson & Johnson and from Sanofi, that are already on the way. Hopefully, the data will be impressive enough to the FDA to allow for authorization of the use of the vaccines this week. This is unprecedented, and it's not because of cutting corners. It's because we have great scientists and a phenomenal pharma research and development community. It means that we as a country can have hundreds of millions of our population immunized in the next 150 days, which is less than a year from the time when this virus first became a problem. So we just need to hang on. We need to do the things that are effective. We need to social distance, and we need to wear masks. Those are the things we need to do to get through to the summer, because by then most of us will be eligible to be immunized.
Dr. Baskies, thank you so much. We could talk forever on this. Appreciate it.
Thanks, Lucy. Go Eagles.